Please can you make a video on using Symbicort turbohaler? What's the side effects and is it safe to use? Alright, so I don't have a Symbicort turbohaler, but I've got a different turbohaler. So the first thing you want to do is twist the cap off, and then you want to check the expiry date. So this one expires in 2024, and then you want to have a look at the dose count. So it tells you how many there are. This one's almost out actually, so it may not work if I actually needed it. The next thing you do is you want to twist the bottom all the way one way and then all the way back until you hear the click. Now some people's will be primed differently, so some of them you have to turn it one way first and you hear the click, and then you turn it all the way back. It doesn't really matter as long as it has a click. As long as you do two movements, you'll hear a click at some point. You'll either hear it at the end of the first movement or the second movement. It doesn't really matter, but that click means that it's been prepared. So then you create a tight seal with your mouth over the mouthpiece. You want to either ideally be sitting upright, tilt your chin a little bit back. You could be standing if you want, but you want to tilt your chin a little bit back to keep your airways open. And then once you've created a tight seal, you want to take a sharp, deep inspiratory breath, as deep as possible, and then hold your breath for at least 10 seconds or as long as you can. Okay, so I'm going to demonstrate. I'm not going to count to 10, but I'll show you. So upright, tight seal with my mouth, all the way until I can't breathe in anymore, and then I just hold my breath, count to 10, and then breathe out. And that's how you use one of these inhalers. In terms of the side effects, look, there are loads of side effects of all medication. I don't really want to go through those because it's going to scare you. In the same way that if you read all of the side effects about paracetamol or ibuprofen, it would terrify you. These medications are generally considered life-saving treatment. If you need to go through the side effects with a clinician, please speak with your doctor. And yes, they are generally very safe to use. If they've been prescribed for you, then your doctor deems that it is important for you to use them, because if you can't breathe, it can be very dangerous. But I will give you a little bit of info about Symbicort in general. So it's got a steroid in it, and it's got a long-acting version of what's in my inhaler. So that means that you're meant to use it twice a day. You use it for a long period of time. The steroid helps reduce the inflammation in the airways and therefore reduces the risk of you having asthma attacks. And the long-acting blue inhaler helps to keep your airways open. So it's very good treatment. It really agrees with a lot of people. Some people it may not. Some people may want to go back to their old combination of a brown inhaler like this and then a separate blue inhaler. But current guidance is that having a combined steroid inhaler with a long-acting blue inhaler is currently first-line treatment. But I can't give any specific advice about people's personal cases because I don't know your full history. Please, if you have any questions or concerns, book an appointment with your asthma nurse or even with a nurse or a doctor at your surgery.